Children that have been raised this way get real good at reading other people because you become hypersensitized to watching your borderline parent. You're watching for this mood change. You want to know when to duck and run, when to find somewhere else to be, when to get out of the situation where you don't have to put up with all of the wailing and blaming and shaming and crying and all of that. So you learn to watch and read, but they don't learn to measure their own internal emotions. They don't learn to measure what's real within themselves and pay attention to how they're feeling. They don't label their own emotions. They don't realize, hey, I'm feeling a lot of shame here. And so they're real good at reading other people, but not real good at reading themselves. They do have strong feelings of shame. There's a lot of codependency there because they're reflecting this caregiver, this mother or father that's engaging them, sucking them in. Children find a hard time setting up boundaries, so they get sucked in by this instability terribly. And then, as I say, if you're on the bad side of that splitting, boy, it can be really, really tough. If you're living with a borderline personality parent, or you've been raised by a borderline personality parent, think about it. You'll spot these things if you look back now. They'll describe opportunities as being completely safe or total con. Don't go out with this person. Don't let them be your friend. They'll describe your friends as either evil and crooked or just absolute saints. These are just angels. They're just perfect. When they hear something, we've been through the pandemic and you've got a lot of people talking about COVID and should you wear a mask or not? Should you get vaccinated or not? Should you quarantine or not? Et cetera, et cetera. In splitting, they're going to decide this is either a complete lie or it's the absolute gospel. They won't take it all in and weigh the preponderance of the evidence and make a decision based on the different facts, evaluate them carefully, thoughtfully, and make an informed decision. No. They're going to decide this is either the absolute gospel truth or it's a complete lie. Again, they live in the emotional extremes. You just need to watch out for it and know that this is something that can be treated. If you've been raised by a person like this or you know somebody that can, just know that they do respond to treatment. And, what is the treatment? Well, it's a form of cognitive behavioral therapy. Dialectical behavior therapy is an evidence-based therapy that does have some good success with borderline personalities. Now, I'm not saying that you cure this and all of a sudden it just goes away, but DBT is a cognitive behavioral therapy with added strong emphasis on change, acceptance, and acceptance on balance change. We're talking about identity and change of negative internal dialogue and pushing for positive behavioral change. And what I mean by identifying and changing negative internal dialogue is you get the person to listen to what they're saying to themselves. Because if you heard the internal dialogue of a borderline personality disorder individual, they're saying a lot of catastrophic things to themselves. And I'm a big believer in the power of language. Ask yourself what you're saying to yourself. Do you use a lot of catastrophic language? Are you the kind of person that says, oh, that was just horrible. My day was horrible. Well, words are very powerful, and they bring a lot of meaning with them, a lot of baggage with them. And if you say something, oh, that was the most horrible day of my life, it was just terrible, it was just catastrophic, Those are big words as opposed to, it was a very annoying day. The difference between horrible and annoying are really different when you stop and think about them. Horrible is having full depth burns over 70% of your body. That's horrible. Having to put up with this annoying person sitting next to you at work who talks all the time and bugs you, that's not horrible. That's inconvenient. That's annoying. So part of dialectical behavior therapy is getting the person to listen to what they're saying to themselves, identifying what they say to themselves that's really negative. You're no good. Nobody likes you. Everybody's abandoning you. This was horrible. It was terrible. And changing that, and then pushing for positive behavioral changes, behaving their way to success. There's also a focus on distress tolerance. It focuses on acceptance of situations. It is what it is. Deal with it. It's not trying to blow smoke up and say, oh, hey, everything's fine. Everything's not fine in life. And there's a lot of value in learning to accept the fact that everything's not fine and toughening up where you have some tolerance for distress. So you don't fold in the face of any kind of adversity. DBT helps these people, particularly those with borderline personalities, to not overreact, to just say, okay, that was not good, but I can handle that. It raises their tolerance for distress where they don't melt down and fall apart emotionally whenever they face adversity. They come up with change-oriented strategies. Here's how we're going to do this differently. You used to do A, we're going to learn how to do B. And they teach interpersonal effectiveness as part of this therapy. Here's how to handle your relationships in a way that are much better for you than what you've been doing. You know, a big part of this is what's called mindfulness. This is often where each session will begin. You develop the ability to observe and accept versus judging and avoiding. Now think about that. Observe and accept what's going on in your life, in your relationships, at your job, at home. You observe it. Say, okay, I see what's going on here. And I'm going to learn to accept that instead of judge it and run from it. That's what I mean about distress tolerance. Mindfulness is a big part of this. Awareness of the moment. You live in the moment and you learn to accept it. You focus on the moment and accept your feelings, thoughts, and your body sensations and say, okay, I'm okay with this. I can live with this. And this is kind of a meditative exercise where body, behavior, emotional awareness without judgment. You might say, I get anxious when I come into a room because I'm so used to being rejected and abandoned that I get this anticipatory anxiety. Well, okay. All right, we're not telling you you don't. What we're telling you is acknowledge that and learn to live with it. We're not trying to tell you to pretend that that doesn't happen. Then it happens, then okay, let's learn to observe that and accept it. If you walk in the room and it happens and you've learned to observe it and accept it, then you say, okay, this is the anxiety that I knew was going to happen. It always happens. And it always goes down. It always abates after a little time. So I'm going to accept this. I'm not going to judge it. It just is. And maybe I'll learn how to deal with this at some point, but right now I'm just going to observe it and I'm going to accept it. You identify these difficult emotions without self-criticism. It's not about whether they should be or not. They just are. Think about that, because that's good for everybody, in my opinion, whether you are dealing with a borderline personality or not. Sometimes we just have to accept what is. This just is. This is just part of our life, and we have to raise our distress tolerance levels. And I have to say, I think the world could really benefit from raising our distress tolerance right now, because it seems like we're pretty hair-triggered. And I think if everybody could toughen up a little bit and not be so hair-triggered and so quick to be offended, even at ourselves, we would be better off. It's about the here and now. It's not about focusing on the past or the future. It's not judging yourself for the past. You always do this. You've done this a million times. I'm so sick of you. No, we're not going there. We're not going to live in the past. You know, there's a reason that your rearview mirror is so small and your windshield is so big. Because that rearview mirror focuses on what's behind you, and that windshield lets all the light into the moment of where you are right now. And that's what we want to focus on, is right now. Focusing on the moment really helps you get into stress reduction. So there is a way to teach borderline personality disorders to be less reactive and more accepting of themselves and others. And research tells us this is what's called an evidence-based therapy, meaning that there is evidence that this therapy does have positive results for those that have this disorder.